A very good evening to everyone. Thank you for joining us at Copy with Vance. That's right. Today's topic it's going to be a little more interesting because every week or every 2 weeks once we're trying to come live with my special guest and speaker as well on a different topics. And today, again, it's going to be a little more deeper into very alarming issues that not only in Singapore but all over the world, which is diabetes. So that's why today our topic is sweet as diabetes. I'm not going to waste any more time, but I'm going to call up my guest speaker, Dr. Shalena. She's an endocrinologist, a physician, and a consultant. So let her get her up here. Let her live. Hello, doctor.
Hi, Vance. How are you?
How are you there? Cheers.
I'm good. I'm good.
Are you having your cup of coffee today?
Had mine dose for the day. Thanks.
All right. So,
Vance.
doctor, thank you for joining us today.
Thank you for inviting me, Vance, for giving me this opportunity to share with the viewers a little bit on diabetes. Okay, as we know, November is the month of diabetes awareness, and November 14th is World Diabetes Day.
Okay.
All
Thank you
right.
for that information, doctor. I mean, it's something that we all should be alert and take precaution because I know today's topic is going to be very interesting because we talk about the issue, we talk about the possibilities and the risk factors.
Yes.
And I also, I mean, as spoken to you, you also mentioned that what are the things that we can prevent it, right?
Right.
And the lifestyle that every of us are going through, even stress, even food, or even exercises. So today we're going to talk everything about that. But before we go on, I would love you to do a short introduction about yourself and your profession so that our viewers will know you a little bit more better.
Okay, thanks, Vance.
Over to you, doctor.
All right. Hi, everyone. I'm Shalena, and I'm actually a practicing consultant physician and endocrinologist in one of the main government hospitals here in Klang, Hospital Tengku Ampuan Rahimah. And I'm also a visiting consultant for two other hospitals. One is Sri Kota Medical Specialist Center in Klang, as well as Hospital Umrah in Shah Alam. So the reason I've been practicing endocrinologist for close to 4 years now, and the reason why I chose this field as my practice of interest is because I myself am a diabetic, and I've been a diabetic patient for the last 18 years. So I thought with this, what better way than to share with my patients how do you deal with diabetes? How do you live with it? What are the complications that arise from diabetes? Because we do know diabetes is a chronic, non-communicable disease, right? And so a lot of people, I think the moment you tell them they have diabetes, the first thing is, I think they find it very difficult to accept, right? Because there's a lot of changes that you need to adapt to, lifestyle modification, your diet, and then comes the medication. So I think the first thing to that once is acceptance. You need to accept the fact that once you're branded as diabetes, you need to accept the fact that it's going to be with you for lifelong. So the moment you accept that, then I think moving on and living with the disease becomes very easy. All right.
Thank you, doctor, for that a short introduction of yourself. But I'm sure there's more deeper to it because as we spoke about last week on the slides that you're going to share, because it's an amazing slide because I love to have all those slides, that 60 over slides.
70 odd slides, you had to eyeball and go through one by one, yes.
It's more like a presentation, a full class presentation, because it gives you a very in-depth of the breakdown, right? The issue, the prevention, and the solution. So I think it's very good. But unfortunately, we have to cut down the slides to 15 slides. We try to squeeze in a bit there and here, which are very more relevant. So are you ready to start the presentation?
I am when you are.
All right, doctor. So all over to you. To the viewers, if you do have any questions, please feel free to ask us in the comment section, and we will take it as we go on. And if that particular topic is within that question, then of course I will definitely ask Dr. Shalena to explain more about it. But if not, we can keep it to all at the end. But if you have anything, just roll it out, because today it's all about sharing and caring. So doctor, all over to you on your presentation.
Okay, thanks, Vance. Okay, so the topic for today is, as you can see, is sweet as diabetes, and we're going to share a little bit on how to prevent it. All right. Okay, so diabetes mellitus was basically coined from a Greek word which means siphon or to go through, and mellitus, on the other hand, means sweet. So that was the term of excess sugar being passed out through your urine. Okay, so basically, what is diabetes? Now, diabetes is actually a disease in which the body's ability to produce or respond to the hormone insulin is impaired. Okay, our pancreas produces insulin, but it may not be sufficient enough to metabolize the carbohydrates that we are consuming, hence leading to elevated levels of glucose in the blood and in the urine. Okay, next month. All right. So what you see, the statistics shown here is actually from the IDF. Now, what is actually IDF? IDF is the International Diabetes Federation. It's an umbrella organization of 240 national diabetes associations in 168 countries. All right. So now, basically, they have come up with the statistics in 2017, whereby 1 in every 11 adult is a diabetic patient. Okay, and we are talking in terms of age from 20 to 79 years old. All right, and they predict that by 2045, 1 in every 10 will be a diabetic. Okay, and hence 1 in every 2 goes undiagnosed. Okay, and 1 in every 5 adult that is diagnosed is above the age of 65. So that is basically the statistics that is being shown right now. All right.
Doctor,
Okay.
so let me just ask you. So, looking at these statistics is a bit quite alarming, but I mean, we all know. I mean, one of the high. I mean, these two are actually raising each other. The atherosclerosis and also diabetes is almost fighting each other. But looking at this, I think is it because of our lifestyle? Is it because of our food or because of stress? Do you think the numbers are going way much more faster than myocardium is taking over, or my myocardial infarction is taking over? What is your take on that, doctor?
Okay. For me, I think being an Asian per se, I think one of the main cause. I mean, one of the main culprit here that we're looking at is the lifestyle as well as the food intake ones. Okay, I mean, Malaysians, Singaporeans, I mean, we love our food. That goes without saying. We love our food. All right, and then comes with the lifestyle, the sedentary jobs that most of us do have. Right? I mean, we seek for easy transportation. We choose to park to the nearest to the entrance of any mall to walk in. That's what happens, right? If you can walk down to the shop which is so nearby, we rather drive down. So basically, a lot of it is lifestyle plus food. Of course, not forgetting there's also family history that plays a major role in it as well.
So we got to say that it's all it's not only one risk factors, but so
No,
many
no.
risk
There are
factors.
multiple risk factors, and of course, when you have diabetes, of course, the risk of you having cardiovascular disease is 2 to 3 times higher than a non-diabetic patient. You're higher risk of it, definitely.
Okay,
All
thank you,
right.
doctor, for that.
Okay. So you need to ask yourself, are you at risk? Because every 8 seconds, someone dies from diabetes. And when we talk about someone dying from diabetes, it's just not plain diabetes per se, but the complication that arises from being a diabetic patient. All right. So it can either be patient who probably dies out of stroke, a heart attack, kidney failure, infection, sepsis, and the list goes on. All right. Okay. So yeah, so you need to ask yourself, are you at risk? So we will be telling you later on what are the risk factors. Before that, we'll just run through very quickly what are the types of diabetes that we know of. Okay, first of all, there's the type 1 diabetes, which is usually diagnosed in childhood. Is an autoimmune disorder. All right. Mainly in children, they sometimes do not have symptoms. Their symptoms is a very short duration, but when they come in either a diabetic coma. All right. Okay. And this is because the body fails to produce sufficient amount of insulin. It makes very little or no insulin at all. So these type 1 diabetes become insulin dependent. All right. So from the time we diagnose them, we run out the antibodies. It's confirmed it's a type 1 diabetes. They are put on insulin. Okay, they need insulin. It's a lifelong. They need the treatment lifelong. They cannot get away without insulin.
All right,
Okay,
doctor.
all right. Then we have the type 2. Now, the type 2 is what we commonly see. Okay, it's very common, mostly occurs in adulthood. But of course, seeing the lifestyle now, we are capturing more and more younger ones. All right. In my practice, we have seen a lot of teenagers coming to us with type 2 diabetes. Okay. The body is incapable of responding to the insulin that's produced by the pancreas, what we call insulin resistance. Okay. A lot of them have got family history, and it's also due to increasing rate of obesity and failure to exercise and eating healthy. All right. Okay.
But the question right now, doctor, is surrounding us, or we are surrounding them, all the good foods around. So there's a lot of temptation, right? Especially
Yes.
soft drinks, carbonated drinks, food. So it's a
Okay.
bit challenge. So is it more on psychological, and also because of stress eating?
Yeah, like I said, I mean, we love our food. And me, myself, being a diabetic patient, I won't deny that, yes, I do have cravings. And of course, there are cheat days. But I guess if you learn how to portion out your food, all right, and limit your carbohydrate intake, then you're good to go. It's not to say that diabetic. I think a lot of patients have the misconception, and why it's very difficult for them to accept the fact that they are diabetic is because the moment you tell them you're diabetic, the first thing they think is, I cannot eat anything that's sweet, which is wrong, right? You can eat, but it boils down to portioning out your food, small portions, right? So if you're one who used to eat 2 scoops of ice cream, then you need to cut back, right? You still can enjoy your food, but once again, it's how you're going to portion it out.
So, doctor,
Okay.
is there a indication or mark that so much of grams of sugar can I take a day? I mean, of course, we as much as possible we want to avoid that. But is there any indication of markers or any international standards that one should not be eating more than, say, 15 grams of sugar, example, or 8 grams of sugar? Is there any standard or benchmarks there?
Like for the type ones, when because they are dependent on their insulin, so we actually teach them to do carb counting. So how much of carbohydrate they consume goes with the insulin. You see? Yeah. So I mean, I would tell my patients, as long as you reduce your carbohydrate intake and increase on your green veggie, even fruits, you need to be a little bit careful ones, because fruits still do contain sugar. So you cannot replace a meal having a bowl of fruit or a fruit salad. That's wrong, right?
Yeah.
Yeah. So
And
it's basically
doctor,
a balanced out diet.
even if you take like a fruit, also got fructose. Even if you drink like any sugary drink, it's also sucrose. So everything that we eat or
Yeah.
consume, there is a significant number of grams of sugar.
Yes. Yes, that's true. That's why I say you need to portion out. So we will tell our patients, what we have is in Malay is what we call suku separuh, right? So it's a quarter. If your plate is round, you divide it into four. Then a quarter of it will be your carbohydrate, and then you have your quarter protein, and the other half would be your veg and your fruit, right? Okay, so you balance it out. So if you're going to take fruits, it's not like eating one whole mango or one a long piece of papaya. You have to portion out. So what I tell my patients is, as long as it's not it's as big as the size of your palm. That's one way to judge it. You see, to make it easier for my patients, I tell them, you're going to eat a banana, just make sure it's the size of your palm. Or the slice of papaya. When you go to the hawker centers, they sell that long papaya, right? The sliced papaya. Yeah. So make sure it's just the size of your palm.
Doctor, right now, I mean, I think all over the world, they are now talking about reduced sugar. But
Yeah.
we're not going to mention any particular brand, but let's say if I'm walking over a refrigerator in a supermarket or somewhere, and I take up a sugary drink, it can be about, say, 25 grams of sugar or maybe 18 grams of sugar. But now they say that it's in low or reduced in sugar, but that also contains about 12 grams of sugar, which is about 1 tablespoon of sugar. I mean, 1 tablespoon, it contains about 14 to 15 grams of sugar. So
Yes.
that's scary if I'm going to have little bit of that every week. We just have to measure by the grams of sugar that we take or the tablespoon. Then in a month, we are taking tons and tons of sugar. So are we in the human population heading towards diabetes if we don't follow these basic measurements or basic necessary things that we should be taking in? What is your take on that, doctor?
Okay, okay. Let's be honest and frank once. Everything that you consume has got sugar in it, right? Okay, whether it's a reduced carbonated drink or your zero Coke, there is some form of artificial sweetener in it, right? Okay, so if you're one who needs to, that's why I tell my patients, you need to cultivate the habit to get off those carbonated drinks. Once in a while is okay, but an every week consumption is a big no, right? Of course, because sometimes you do have the craving, or it's a very hot day, you want to chill down on a cold drink. Yeah, go ahead, all right, but not on an every week or not on an everyday basis. That's fine, because if you're going to tell your diabetic patients you can't have this and you can't have that, then eh, they're just going to defy it and go ahead with it. So it's
Okay.
no point, right? So you got to give some leverage and tell them yes, you can have, but it's not an everyday habit.
Okay.
All right.
Okay.
All right, so the next one we're looking at is what we call gestational diabetes. It's very common in pregnant mummies, all right, where the, what we'll say, okay, women who give birth to children over 9 pounds or probably 4 kilos if we convert it into kilograms, okay. Now, these mummies during pregnancy, when they're diagnosed to be diabetes, okay, post delivery, we would normally screen them 6 weeks post delivery. All right. Now it can swing either both ways post delivery. They can revert back to normal, whereby the diabetes disappear, or they continue to be diabetic patients. Okay. But statistics have shown that if a mummy has been diagnosed to be a GDM, gestational diabetes, all right, then 5 to 10 years down the lane, the risk of them continuing to be a type 2 diabetes is about 80%. Okay, so if any of you or the listeners listening in there, if you had diabetes during any of your pregnancies, okay, we would advise you to do a yearly screening. Okay, just do a yearly screening, because the risk of you developing diabetes within 5 to 10 years later on is about 80%. So that's something you might want to look into later on,
But
right?
for this particular case, doctor, is it also a quite rising cases in the woman? Because I personally feel that there was a, I mean, the people that I know, but I'm not sure about the statistics. But is there a high rising cases for these particular cases, for this
Yeah,
particular issue?
because these pregnant moms, they probably already have history of parental history, family history of diabetes, right? Or obesity is there, or age. So the risk factors come into play as well once.
Okay. Right, doctor. You want to go to the next slide?
Sure, no worries. Okay, so now what are the risk factors that are we are looking at, and who are the ones that you probably want to go and screen? Now, if you have family history of diabetes, when we talk about family history, is first degree disclosure. So it's either your parents or your siblings or your uncles and aunties, those who are overweight. Okay, if you have an unhealthy diet, that means your breakfast, lunch, and dinner is always very high in carbs. Okay, we Malaysians, we love our food, so of course, breakfast is either roti canai or nasi lemak or some kueh, followed by your lunch, and your dinner is also rice. Okay, if you're someone who's inactive, you lead a very sedentary lifestyle. Okay, it's just going to office, sitting at your desk job. Okay, maybe these are the four the top risk ones that you may want to consider going and screening. All right, of course, with increasing age, if you're someone who's got blood pressure, right, you have got dyslipidemia or high cholesterol, if you're someone who has the habit of smoking, alcohol consumption, okay, ethnicity, majority of the higher risk is, we find they are highest among the Malays and the Indians.
Okay.
Okay, you have impaired glucose tolerance, if you had history of gestational diabetes in the past, or you have poor nutrition during pregnancy. Okay, so these are the ones that we call out to go and do your screening. Right now, if you're asymptomatic and you do not have any of the above risk factors here, okay, but you're 30 years and above, then please go and get yourself screened. If it's normal, if your screening comes back normal, then please do a yearly annual screening. All right? Okay.
For most of the cases, doctor,
Mm.
I mean, of course, you talked about the four main factors here: family history, overweight, unhealthy diet, and physical inactivity, right? Do you think that physical inactivity plays an important part? Because if I'm going to ask you which of the four are the most in the top, in the range, probably you'll say all the four. But I don't know. Do you think that because we're not moving, like you said, we park near to the shopping centers, we take the escalators instead of the stairs, we are in the comfort zone all the time, and we don't want to be in the discomfort zone even for a while. Is that the reason why the more populations are coming up? We talked about the numbers earlier on when you mentioned there's almost about by 2045 there's about
One in
48%.
every 10. Yeah.
Is it because we are not moving much? What
I
is your
think
take?
it's basically a vicious cycle once. It's a vicious cycle, right? You physical inactivity, you eat unhealthily, you tend to become obese, right? So that extra weight on your body, you find it very difficult to move, right? It's to start doing exercise. I'm sure you being in the fitness this one, I'm sure a lot of your clients do come up, and the problem is initiating the exercise, is getting down to it, taking that first step, changing your lifestyle, right? But I always tell my patients, when we treat diabetes, it's just not about changing your diet and putting you on medication, because for me, I personally feel that physical activity plays a heavy role in it, right? It does contribute, and it does help to control your blood sugar.
Will you also add in stress factors, because stress because that actually a pathway for a lot of binge eating, overeating, stress
Yes,
eating. So
yes.
I don't know, some are psychological, some are physical, but do you think that stress also plays a very important part
It does.
into?
I totally agree with you once, because when someone is stressed, it's not only about binge eating, but also the other hormones that come into role, right? You got your cortisol going up, so all that contributes to high sugars as well.
All right, doctor. So we will move on
Awesome.
to the next slide, and of course we can always come back and forth. So all the viewers are there. I mean, if you have any questions, please feel free to post a question, and we'll try to take it in because we are with the expert here. Uh, she always with a smile. So let's go on. So here we come. Symptoms of diabetes, doctor.
Yeah. Okay. So how would you know? I mean, for someone who's not diabetic, but you have all the risk factors, you've got family history, you're obese. So how do you know whether you yourself you're suffering from diabetes? Okay, so these are some of the things that you can look out for. All right, you can do a blood. You can, if you have a dextro glucometer at home, all right, you can just check your sugar. So high levels of blood sugar, if your fasting is more than 7 and a random is more than 11.1, yes, okay. That's one of the symptoms. Okay, if you have blurring of vision, if you find that your visual vision starts to have a little bit of disturbance, okay, you become extremely tired, okay, thirsty, you're always craving for and surprisingly, some of them say that they crave for sweet drinks. All
Mm.
right, okay, sweet drinks. Painful urination or frequent urination, mostly at night, is what we call nocturia. Okay, so which means on an average, normally somebody will probably wake up about once, or probably doesn't wake up at night to go past urine. But a diabetic patient, if you're poorly controlled, or you're not, if your sugars are very high, you will find that you're actually waking up at least about 2 to 3 times at night. Okay, you'll have a disturbed sleep because you're constantly running to the washroom. Okay, or if you have a wound or a sore that does not heal within a week or two, okay, and you find that sore is becoming bigger, and there's a lot of discharge from it. Yeah, you might want to get a professional help to have a look at it. Okay, nausea, vomiting, these are the ones that when we find the sugars extremely high, they're coming into the hospital into a diabetic ketoacidosis. Okay, the symptoms of nausea, vomiting. Weight loss. Okay, if you have drastic weight loss, a very unhealthy weight loss, somebody comes and tells you, you're not doing any exercise, you're not dieting, all you do is you tend to eat, you lead a sedentary life, but your friends come and tell you, hey, you've lost a lot of weight. Okay, now this is something, it's not a compliment, but I think you should actually go and get yourself checked. And you're persistently hungry as well. Okay, what you eat, if you have a heavy meal for lunch, within an hour or so, you are craving for something else again. Okay, so these are some of the symptoms to look out for, right? Okay,
Uh,
once.
is it only at night the urination take place? Is that something to do with the your system or the endocrine system that always because you are at rest? Is that the reason why they always go frequent? Because we do have people saying that they do go urination at night only very often. So is that a strong indicator? Because of course we're looking at other factors as well, but is that the only indicator?
Generally, and no advance, but this is one of the symptoms. We make it easier for the patient to find out whether are you getting up at night to pass urine a lot, right? Because daytime you'll probably be drinking a lot of water, then you're running to the bathroom. That's okay. But at night when you go to sleep, there should be no reason for you to wake up to run to the bathroom.
All right.
Okay. All right. Okay. Do you have any questions so far?
We have a lot of viewers coming in, and of course, I got few questions that's in, but I think we will take it later.
Okay.
Because we have a member by the name of William, so we will address that later. So we can go on with the presentation, Doctor.
Okay, so next we come to the complications of diabetes. All right. So once when we talk about complications, we are looking at what we call the microvascular, which is the small vessel complications, as well as the large vessel complications, the macrovascular complications. Okay, so your microvascular complications will include things like your diabetic retinopathy, eye changes. All right. Diabetic nephropathy, where you have kidney changes and ultimately you end up going into end stage renal failure and subsequently dialysis. All right. Then you have diabetic foot ulcers, okay, whereby every 30 seconds a lower limb gets amputated in the world. Okay, this is for people who have poorly controlled diabetes. All right, those with diabetes, the kidney, they have a 10 times higher risk of developing end stage renal failure compared to someone who does not suffer from diabetes. Okay, and one third of the diabetic patients will ultimately have diabetic retinopathy. Okay, so these are the small vessel complications. Then of course you have the large vessel complications, which could end up with cardiovascular disease, a heart attack. So these diabetic patients are about 2 to 3 times higher risk of developing a heart attack, okay, and stroke compared to someone who doesn't have diabetes.
All right. So we can say that due to lack of activity, no proper food planning, and stress, and of course environmental. Of course we got all the foods, good foods around us. I mean, involvement of that, of course, eventually you become obesity, and that also ranges a lot of other effects taking place. Then probably your heart is overworking. You might get a blood pressure, and then the atherosclerosis, then the diabetes. So this looks like a family relationship, right? I mean, the
It
father,
is.
the
It
mother.
is. It is a package. It's basically a package once because the moment we get the diabetic patients, when you actually screen them and you work them up, you end up we find that they have got some. By the time they come to see, majority of them already have got some kidney involvement, all right, or eye damage, or they've already been hypertensive. Okay, and definitely they have cholesterol on board. So I always tell them it's a package. When you end up with diabetes, if you don't take care early, you don't screen yourself early, and you don't come in early, then you're going to end up with this whole package in time to come.
So we have here a list, the recommendations for a healthy diet for general populations. Do you want to go there without Doctor?
Yeah, sure. So these are just a little bit just to guide you how you can change your diet, okay? But you can still enjoy what you like, all right? So rather than go for something that's like a juice on a daily basis or soda or any sweetened beverages, maybe you want to switch to choosing plain water, okay, or coffee and or tea. All right. Okay. Once again, once things like coffee and tea. Also, you've got a lot of products in the market. You've got a lot of three in one. You've got your coffee bean. You've got Starbucks. Right. Okay. So when
Yeah.
we talk about coffee in this one, I would normally tell my patients go with either you go with black coffee with a little bit of low fat milk. Okay. Three in one is definitely not encouraged for diabetic patients. Okay, because bear in mind the three in one has got its creamer and sugar. Likewise, the 2-in-1 is also said is the creamer. So the culprit there is your creamer and your sugar. Okay, so you're still safer to go with black coffee, plain tea, water. Okay, if you want, of course, once in a while you want to have a fruit juice, yes, by all means, please go ahead. Okay, have 3 servings of vegetables. Okay, 3 servings of fresh fruit every day. Now, once again, like I said, when we talk about fruits, because they also contain sugar, it's you need to portion out. Okay, so if you're one who wants to eat jackfruit, just probably one piece of that fruit, because it's very sweet. Okay, durians, right? We Asians love durians, so not more than two pips. All right, not every day. Okay, maybe once in a while you want to give it a go. Yeah, grapes about 5 to 6. So you still can enjoy your fruits, but it's not substituting the fruits as a meal. You understand? There are a lot of patients who come and tell us, I don't eat, I don't have dinner. But when we check the sugars the next day, it's actually very high. But when you actually sit down and talk to them and find out what exactly they've had for dinner, they'll tell you, no, I didn't eat rice, but I ate a bowl of fruits. So that's wrong. All right. Okay. So for those alcohol wine lovers, limit yourself to about to maximum of 2 standard drinks per day. Okay. Choose lean.
This is a very interesting topic. So, I mean, this is one of the accidents.
I see that kind of caught your eye once.
No, because I have a particular friend. It's good to say
Okay.
it's a friend. He drinks 1 glass of wine every day.
Okay.
So I assume that he's taking 7 glasses of wine every week,
All right.
right, doctor? So 1 glass a day, and we all know that one bottle is about 5 glasses of wine, right? So he's taking about 4 bottles a month. So again a question that when we say that we can take wine, sometimes it's a bit, hey, why don't we can't take wine? We are training hard and we are eating carefully and stuff. So what is the gray line, doctor? Are we looking here? Because if we calculate the total number of days, it goes into bottles. Or are we going to like say 2 glasses per week? It's going to be impossible. I mean, if you go with family, friends, or businesses. So how one can able to manage these particular wine consuming or wine enjoying habit? What is your take on that?
It's very difficult once to really put a cutoff point there, because there are, like you said, there are some people who need to have their wine with their food, right? It's a daily habit, right? So once again, I think if you can balance out, it's all about, it comes back again once again to balancing out, right? So I think if you can limit yourself to 1 glass a day, but then of course comes, are you going to exercise? Are you one who exercises? Because you need a balance in it. It's just not all about eating and controlling, because you still, I can have 1 glass or 2 glasses of wine, but I'm burning it off through my exercise.
Is this something you do with the habit as well? Because if
I
I'm
think basically this, I believe that this alcohol, this one is a habit lah. It is a habit. Yeah.
so I'm going to tell my friend
Yeah.
to have
So basically you can tell him,
I'm going to tell my friend to have 1 bottle of wine every month, which
okay,
means about 1.5 glass per week. Is that
that's
possible?
good.
I'm not sure you can do that, but we can try, right?
Yeah, yeah, this is good. Yeah.
But if his activities is there, he's not inactive, he's starting to train and he's controlling his portion of food intakes, he doesn't overindulge, he's cut down on everything. But this particular, wine having pleasure, sensation, I mean, people need to relax, so they go into that kind of even doctors are encouraging to have wine as well for good
It
heart.
is good for the heart.
So, yeah. So we are not promoting wine drinking here, folks. People who are listening to this, as we are just having a great conversation. Everybody, I know some will love it. Some will not even go there. They will have water. That's perfectly fine. It is the choices. But what we are discussing here is how do we plan ahead, or how we can prevent it in terms of the choices that we have. So what else do we have in this chart, doctor? I mean, we do see some whole grain, brown rice, quinoas, and so forth. What is
Yeah.
the take on that as well?
So compared to having white bread, of course, we would encourage our patients to have something that's multigrain, wholemeal based, so that that's extra fiber in it. All right. But once again, if you're going to tell my patients, of course, it's not, if you're going to eat 4 slices of wholemeal bread, then it defeats the purpose, right? Because patients come and tell you, but I'm eating wholemeal bread, it's still safer than eating white bread. So I go for 4 slices. No, please limit down your portions again. Be very careful of how much you're going to consume. Okay. So yeah, the whole thing about diabetic patients, you can eat, but you need to control your portions. I think the problem with our population is we just don't know how to control it, right? When we love food, we go all out and attack it, right? There's no stopping to it. I love this, and I must have that sort of thing. It's just not small portion, right? Okay. And
I'd
the
like to share this, like what echo as just what you say, doctor. I mean, if someone is going through this kind of food planning, right? Because we always hear this thing very often in our fitness industry. People always go on a diet. There's so many kind of diets, Atkins, zero carbs, high protein, so and so forth. But if someone who's going into a diet, right, and having zero carbs, zero sugar, do you think this will be a lifestyle or will be a yo-yo? Because what I do see is always a pattern. People want to, after they put on like say 3 kg or 4 kg, and say, you know what, I need to lose that weight, I need to go on a diet. So diet becomes not for the health most of the cases, but it becomes more like I put on weight, I need to lose weight. But of course there's a good percentages, we can't calculate the percentages, but people are generally going for lifestyle. This is my lifestyle, this is my health, I need to maintain low in sugar, low in fried stuff, and so forth. But there's still a majority that people think that going under a strict diet would make them lose. Of course, obviously, they will lose weight, but we are talking about the glycemic index, the GI. What is your take on that, doctor?
Okay. Okay. First of all, once when we talk about going on this crash course diets and all, I normally don't encourage. I wouldn't encourage. All right. First of all, because number one is very unhealthy. Okay. If you're just going to go on this crash diet and tell I'm not going to take absolutely no carbs and no sugar, then it's wrong, because you need some form of energy. Okay. And you're not going to get all that energy based from your protein based food. You still need a little bit of carb to give you that energy. All right, number one. Number two, when you go on this crash course diet, what happens is your metabolic rate tends to drop. Okay. And then when you lose weight, and then when you start eating, you're going to binge again. So that weight is going to double. So it's basically a vicious cycle. I lose weight, I'm happy. Then when I start eating back again, I put it all back. Right? So why go through all that when you can actually eat small portions of what you like, but incorporate daily exercise? Okay. So me being a diabetic patient, yes, I admit I started off with being very heavy at about 76 kilos, right? And the moment I found out I was diabetic, of course, there was a lot of changes in lifestyle. I was one who, I mean, I have a sweet tooth. So a lot of changes I made, and of course, I incorporated exercise, and touch wood, I'm actually very happy with my outcome. So that's why I'm able to share with you. It is easy being a diabetic patient. It's not difficult to live with it. Okay, but first of all, you need to accept the fact that once you are branded that you're diabetic, yes, that you must be prepared to make those changes.
Doctor, I mean, you said it very well. It's like a lifestyle. I mean, we can prevent it, but of course, if the risk factors are so much, and then if one is not making any effort to prevent it or to
Yes,
push it away, then of course you are inviting them, uninvited guests. They will just come.
true,
But
true.
doctor, I also want to talk about losing weight, because I know diet plays a very important part in losing weight. But one who adopts a very good healthy lifestyle and at the same time, enjoy your food. But we are looking at the number of portions, or the portions that we are taking in, and the kind of input versus output. But we all know that half a kg of fat is about 0.45 kg. 0.45 kg is about 3,500 calories. So if you want to lose a half a kg, we need to burn 3,500 calories. 1 kg, the math is 7,700 calories. But what has happened is a lot of people are resisting the number of calorie intake, and then it becomes days, weeks, and then the craving just goes up, and the body says, this is crazy, or they can even go into a diabetic coma. So what is your take on diabetic coma?
Okay, diabetic coma is actually what we call is a diabetic emergency. It's a medical emergency for us. Okay, so this is when most of the time we see is those patients who are poorly controlled diabetes. All right, they come in with very high sugars, and when we test the sugar, it can be anything above 30. All right, they can come into a comatose state, and the risk of mortality is very high in that. So that's why we always tell our patients, you need to take care of your blood glucose. You need to monitor your blood glucose. Right, that's why I don't believe in this uh, what is that, this strict dieting process ones. I don't encourage it for my patients. Right, I tell them you eat, but you need to exercise. You need to balance it out. Okay, starving yourself and putting yourself into the starvation mode, no, is really not healthy.
I think you said it very well, Doctor. Thank you for that explanation you go through. So
Mm.
I think we are going into the last segment of the food choice using oil, because oil is a very very interesting topic. You know, we want everything tasty. We want something that is deep fried. Of course, there's a lot of options, the soup wises and olive oil and so forth. But olive oil at a certain temperature, it also can does damages to us as well. Your expertise on this, Doctor. Oil.
Okay. Yeah. So it says down here to choose unsaturated over saturated oil. All right. Okay. Of course, there are many ways to cook your food. You can either steam it or you can grill it. Okay. Of course, lots of us love our fried chicken, right? But there are different methods now. You've got things like air fryer where you can put it. Okay, it may not taste as um, tasty as what you would when you fry it, but it still gives you the taste, right? Because bear in mind, each time you fry a chicken or you fry a fish, it absorbs about 10 tablespoons of oil. Just one piece of chicken or one piece of fish absorbs about 10 tablespoons of oil. So imagine if you are having fried fish for lunch and dinner, that's 20 tablespoons of oil per day. Okay. And I have some patients who just love to eat fried chicken for lunch and dinner every day. So you can calculate how much of oil is being consumed. So this is your risk factor for getting high cholesterol as well as blocked vessels in your heart.
So
Okay. So
basically, we just need to eat greens, grass, and we are
no,
fine.
no. Then once you're sounding like one of my patients, so my
No,
patients
I
will
mean,
what do you want me to eat? Just grass? No, you can. There are many ways to cook your meals. You can steam, you can grill it, you can bake it, right? You don't require that amount of oil. And it's still healthier and still tasty.
thank you, doctor. So I think we should go to the next slide.
Okay, so once what we are seeing here is glycemic index, and basically what is glycemic index? It's just a ranking of the carbohydrate in your food content, okay, that contributes to the blood glucose. So you can see from the chart, if anything that's low in glycemic, 55 and below, all right, it's got low GI, which means it's slowly digested, slowly metabolized, and the sugar rise in your blood is a whole lot slower than a glycemic index of 70 and above. Okay, so if you want to choose something, go for something that's 55 and below, then you're actually quite safe, right? So I'm sure if you Google this up on Mr. Google, you can come up. There are loads of charts which you can actually guide you, which can actually guide you into what is low glycemic index. So choose for something that's 55 and below. Mid range will be about 56 to 69, and anything that's 70 and above, yeah, then maybe you want to be a little bit careful or space it out a little bit.
All right, doctor. We have a viewer who actually just posted a question for us. A name is Samantha R. Very informative. Could you share some symptoms that indicate your eyes are being affected?
Okay, most often or not, you will find it's like blurring of vision. Okay, you probably find that of course this comes with also age related changes as well. Okay, but most diabetic patients, if you're poorly controlled or you've been a long standing diabetic patient for probably more than 10 years and above, then yeah, of course there will be changes. Now our patients generally tell us, I find my vision has become a little bit blurred. So that's one thing to look at. Okay, it's mostly blurring of the vision. Okay, then we of course we refer them out to the ophthalmologist, and they get a proper eye assessment.
And in terms of diet wise, of course, you just mentioned about the GI glycemic index.
Mm-hmm.
Is that something that we should take note also, doctor? Apart from looking at this chart, sometimes when we go and eat out, the way of the restaurants preparing particular food, of course, in terms of within not our control, the salt can be higher, the food can be tastier because of the MSGs are coming in, sodium are high, it's fried. So when we dine out, I think literally we don't have control over certain areas.
Yes, I totally agree with you once. Of course, I mean, when you go out, of course, there's nothing much you can do. So from that, maybe if you were to look through the menu, then you probably would choose something that's rather than a deep fried chicken, you probably go for a grilled chicken or a fish rather than beef or lamb, right? So that means you still have choices. Rather than rice, you probably want to go for a pasta. So there are options you can choose for. But of course, what is life if you don't get to enjoy a little cheat day, right?
Yeah.
Yeah. If not, once you tell
Uh,
me, no, you just keep telling me to eat grass
no,
every day. Yes.
but the problem is every day is a cheat day.
Not for all ones, not for all.
So I
Yeah.
mean, Samantha R also has shared that I heard of people going blind and then it get fixed, which is scary. So what is a take on that, doctor? I mean, is that a alarming issue at the moment when people who have diabetes are not controlling it? Is there
Okay.
an issue?
Uh, these are patients who probably have a very poor controlled diabetes. Okay, so when you come at the very late stage where the vessels in your eyes, in the retina, is already damaged, then there's nothing much that can be done. Okay, so even if you were to do surgery to it or laser, the outcome may not be fantastic. All right, so that's why the moment we are referred a case of diabetes, all right, within the first visit to our clinic, we refer them out for an ophthalmologist eye assessment. Okay, and then after that, it's either a 6 monthly or yearly visit. So you got to make sure if you're a diabetic patient, please make sure that you have an eye assessment at least every 6 months to a year. Okay, even if then there are no complications, your eye doctor tells you, oh, the vision is good, and this one, please make sure you follow up every year. All right.
All
Okay,
right,
Van.
she said
Yep.
thank you there. So yeah, and the glycemic index, doctor, are we going to cover anything else in this particular segment?
No, I think we're good to go from there. So the advice is, if go for something that's low, 55 and below. All right. Of course, like I said, once in a while you want to go for something a little bit higher, 70 and above. Yes, but not on an everyday. Try to balance out so that it doesn't happen on an everyday basis.
So we got to maintain 55 or below. That's
55
a
below or 50, yeah, or mid range will be 56 to 69.
okay. All right, okay. Let's go to the next one. All right. So here we
Okay.
come to the exercise.
Okay, I think that's your favorite one, right, Vance?
Okay. So,
Okay, so maybe we
so,
will
so,
we
so now you're going to be the moderator. I'm going to be a guest
yeah,
speaker.
you read
Okay. So
my
I
mind.
leave the pleasure to you to ask me questions.
Okay, so yeah, as we
Wow.
discussed
You
last
are
week,
ready. You are so ready to ask questions. Yeah.
definitely. Okay, one. So as we know, like, so yeah, okay, exercise is something that's it's part of treating diabetic patients. It's something I would always tell my patients, you need to incorporate exercise. So what's your take on it? What would you suggest, or what would you recommend? I'm sure you've got clients who are diabetic patients as well, right?
So
So
this
what's
is,
your
I think, like what you mentioned earlier, this alarming issue for the whole human population because I mean, so many risk factors that we involve. Even hereditary is also a risk factor for us. Inactivity, right? Not much of activity, also a risk factor. So usually when someone comes to us and want to get into a proper training or a proper food plan, I mean, the first thing like what I usually do is send them for screening because it's very important to understand what is happening inside first before understanding the outer part. And of course, we also use the risk factors scale, which is anybody above the age of 40. And of course, you need to do a medical checkup just to check your HbA1c, which we'll talk about it later. I mean, doctor, I'm sure you're going to share that as well.
Yep.
Also looking at the activity level and also look at the food pattern. I mean, generally, I don't believe in diets, which I usually say eat healthier. Options, go for options,
Totally
because
agree.
you
Totally
don't
agree.
want to go into a serious diet. And how long are you going to be? You can't go on a diet for the rest of your life. You can't be taking rice without for the next 30, 40 years, which is not feasible. But rather, you go for choices of delicious food you can be prepared. Like I give you an example. You can have a quinoa, egg whites, edamame. You can some veggies. You can have, if you are
Salsa,
non-veg.
tomato soup.
Yeah. Okay. So probably.
Korean song which you posted up. Yeah, very nice, very nice.
Okay. Yeah, so that's one of the stuff, but there's so much of options. So coming back to the question, I think very important to go into a very holistic plan. So I don't just put on a diet and say go on a run. These are temporary solutions, but we want a permanent fix. So you rather go on a slow and steady wins a race rather than fast and excited and fall out and then you stop along the way, because the body reacts what
True.
you are input on it. So you got to be very careful of what you plan and what you do for the physical. So it's very gray area in how we actually plan the exercise program. But I would love to share this even more in detail if anybody have that kind of topic, of course, with doctor as well. So viewers, you can also be pleased to ask us questions. We are able to answer that as well.
All
Any
right,
more
thanks.
questions, doctor?
Thanks, Raj. Okay, so yeah, so the recommendations would be approximately 150 minutes of exercise per week. So it works out roughly to about 5 times a week, about 25 minutes a day. If you can incorporate that amount of time of exercise into your daily routine, then I think you're really good to go. Okay, so some of the things that you can do, of course, if you're one who's never done exercises and you're a little bit on the obese side, don't try or attempt to suddenly run. Okay, like one said, you need to go with the flow. You need to go with your capability. All right, so start off, probably maybe you want to do with a walk. Go for a slow walk first. All right, don't attempt to run, because then you're going to come back and end up with a lot of other complications. All right, so here are some of the exercises that you may want to try if you're on the elderly age group. Probably like something like Tai Chi. Okay, yoga is something very good. Okay, dancing. All right, now it's said that someone who's about 70 kilos and above, you can lose approximately about, you can burn off about 150 calories by dancing for 30 minutes. Okay, so if you love dancing, yeah, that's one thing to consider. Swimming. Now, swimming is a pretty good exercise because there is no pressure on your joints. All right. So yeah, 3 times per week, approximately 10 minutes. It's actually quite good. So there are a few exercises. Choose what suits your lifestyle, but just try to make sure that you do something rather than nothing at all. Okay. Right.
Really echo that, doctor, because also for those who also want to start exercising, I know it might be a big challenge. Either it can be a weight loss thingy, or whether you want to put on some mass, or the goal can be anything. You want to run a marathon, or you want to be healthy and be staying fit for the family. But whatever the issue is, I think medical screening is very important.
Yes.
You should see a medical practitioner, a doctor, to get yourself medically fit, just to make sure that the blood pressures are good, HbA1c are fine with your blood glucose level. And then just if you have any pains and symptoms, I think that also should be checked before you come and start exercising, or even if you go and see your personal trainers, or even if you're going to start running. I think that's very important. The problem is a lot of injuries happen when you ignore the pain, because pain are actually indications of the body telling you there is a problem. But
Problem.
if you
Yes.
ignore it, if we ignore it, then it becomes an injury. So the central nervous system, the body system, is just continuously giving us signs and symptoms and pains and sensations. So we have to listen to our body carefully, and then we react to it. I think then we will be safe towards it.
Right.
All right, doctor. So we are going into the next slide. I know you have
Okay.
something to talk to us about this whole big thing here.
Okay.
So what is this update that you're going to share over here?
Okay, so basically, I think in many years ago when I first started out my medical as a medical student, what we learned as an undergrad that diabetes, the main cause of diabetes was the pancreas, insufficient functioning of the pancreas, insufficient insulin. Okay, but over the years we realized that it's not only the pancreas that contributes to hyperglycemia or high sugar per se, but of course the other organs as well, like the brain, your kidney, your liver, your muscles, your gut as well. That's why you see when if you're a diabetic patient, and I'm sure there are a couple of y'all there on site right now, you're probably wondering why is it that my doctor gives me a lot of goodies to take to treat my diabetes, right? Because each drug, each family of the drug acts on different site. Hello? Hi, Vance, can you hear me?
Sorry, I was trying to get a nap here. Oh no, I'm just yeah, doctor.
Okay, so basically, it's just not the pancreas which is the pathology per se, but it's a multi-organ. It's a complex contribution from all other organs as well. That's why you see diabetic patients. They are not only just given one particular drug from one family, but they come back with a whole lot of after seeing the doctors. They come back with a whole lot of different range of medication because each medication acts on different sites. Okay, so that's why you will see some patients they have got two different tablets, some will just be on insulin. So I mean the treatment per se is tailored. I mean it's individual based. Okay, so we don't encourage patients to compare with your friend if you're diabetic. Hey, why am I on insulin and you're not on insulin? You must understand that every patient is different. All right, so what may work for your friend may not work for you. So don't be disheartened. Don't be so disappointed if you come back with a different set of medications and you compare, and your friend is like, oh no, I've only got this, right? Because we have got patients coming and asking us, oh, my friend is taking this, and how come I'm not on that? So that's the wrong thing to do. But I think Asians, being Asians, we tend to do that. We love to compare, right? Okay, so treating diabetic patients is very individualized. Of course, we have guidelines, and I mean, but we go with every patient, right? We see what's best for them based on their age, their morbidity, and what are their risk factors. Okay, so yeah, so different patients will have a different set of medications tailored out for them.
Doctor, I mean, in this particular slide, I'm seeing a hyperglycemia and also the peripheral glucose uptake. I think it's very important. I like to mention here that anybody who want to start exercising, especially if you're diabetic, I think it's very important to see your endocrinologist or doctor to get adjusted on your glucose level before you start exercising, because the intake or the output of your energy system, because your muscle is always constantly using fuel as a glucose as an energy. But if you're a diabetic and if you're taking medication, so I think it regulates. What is your take on that, doctor?
So normally we would encourage our patients that if you're one who's exercising regularly, all right, is to do your blood glucose check, ideally before you exercise, and take a small snack, all right, probably about 20 to 40 minutes before you start exercising. And when we talk about small snack, is like probably 3 to 4 cream cracker biscuits, something very small, or a slice of bread, not a plate of noodles or something. That's considered a meal. So a snack means something very light. Okay, but just make sure you check your sugar, just to ensure that you're not going to end up with a hypoglycemic attack post exercise or during your exercise. That's the last thing you want to do.
And then they can easily fall into diabetic coma. Am I right to say
Yes,
that, doctor?
hypoglycemic coma.
All right. I know next slide we are going to cover the HbA1c and the diagnostic values. So we have three sectors here, doctor, but I know numbers can be a bit different. I mean, for international standards, for Asia and European standards. So are we following the Asia or European standard, doctor?
I'm following the Asian one because I'm Asian.
Okay, yes.
Yeah. Okay. So can we have the next slide, once?
Okay. We are talking about, but doctor, I think this is a slide that we are talking about because it's normal pre-diabetics and diabetics numbers are there?
Okay, I'm sorry because I'm not getting the slide. But no worries. Okay, so
Okay.
basically what is um I mean you're probably wondering what is this term we call HbA1c, right? Everyone says you go to the doctors and you come back and then somebody asks you, so what's your HbA1c? And then you tend to be like, okay, what's he talking about? Okay, so basically HbA1c is actually a diagnostic test for diabetes. All right. So in Malaysia, what we follow is if your HbA1c is 6.3 and above, then you're categorized as diabetes. All right. Now it's normal. That means you do not have diabetes if it's less than 5.6%. And you are categorized as pre-diabetic if it's 5.6 to 6.2. So if you're categorized between 5.6 to 6.2, then you can do a lot to prevent yourself from progressing into the 6.3 and above ones.
Okay.
So that's where your lifestyle, you have to go all out to change your lifestyle, your diet, and maintain that so that you do not, because you have a high risk of going into the category of diabetic. Okay, so basically what is this HbA1c? It's a 3 monthly blood test. Why 3 monthly blood test? Is because the lifespan of your red blood cell is about 120 days. All right, and it's basically the HB which binds to the glucose. Okay, so it's directly proportional to the total amount of sugar in your system. Okay, whereas if you do a blood glucose, which you do a finger prick test here and you check it onto your glucometer, there's just a concentration of glucose in your blood at that single point. Okay, but your HbA1c is an average reading of your blood glucose over a period of 3 months. All
And
right.
it's also the past 3 months of your behavior. Can we say that your behavior of how you abuse the food? Can we
Yes,
say that?
yes, yeah. So it gives the treating physician a rough idea of how well your patient has controlled, over the last 3 months. So when normally when you would go for a blood test and if you have looked at your results, they will definitely have what we call the fasting blood sugar or the random blood sugar together with your HbA1c. Right? So your fasting blood sugar may be something within normal, probably about between 4 to 6. Okay, but your HbA1c is shouting out at 11.5. Okay, so we know that probably, okay, the patient's fasting is 4 to 6, probably because the patient knows, oh, tomorrow I'm going for a blood test, so today I'm really going to starve, I'm going to eat very little, because it's the point of blood test at that single moment, right? Because your HbA1c at 11.5 tells us that for the last 3 months, your average sugar throughout the day is about 14 to 15, even though your HbA1c is 11.5, but the average sugar throughout the day, if we were to check post meal, it will be about 14 to 15. So it gives the treating physician a rough idea of where you actually stand in terms of your control.
All right, Doctor.
Okay.
So now we are looking at this chart of prevention and control diabetes.
Okay. Right. So in this chart, as you can see, we've listed down a couple of things that you need to go. So top of the list, okay, once again is lifestyle modification. Okay, your eating habits. All right. In terms of your carbohydrate intake, basically a healthy eating. Okay, incorporating exercise. Okay, try and do a little bit. Okay, even if you're someone who finds it very difficult to get started, or you find joining a gym may be very expensive. All right, I tell my patients it's okay if, as long as you invest in a good pair of walking shoes or good pair of running shoes, and you walk outside. You've got beautiful parks, you've got beautiful, even the malls, you can walk around the malls. Just don't take your wallet, just take enough money to park your parking fees, all right, and walk through every floor. So I've seen people doing that. They come, they come in their tracksuits and walking shoes, and they do that. Okay, these are people who find, they, or if it's raining, if it rains every day or haze, everything changes. Yeah. So this is one thing I tell my patients. Well, if it's raining and you can't go out to the park, then go to the malls, park your car and walk around every floor. Right? That's a good way. Okay. Now, if you're diabetic, please ensure that you take your medications as prescribed. Please do not miss your medications. Don't underdose, don't overdose. Please follow the instructions as per written on the prescription. Please make sure you check your sugars regularly. All right. Have a food diary. I tell my patients the best way for you to judge and see what gets your sugar up is to actually have a food diary. So you yourself can actually see. So if I have a plate of fried noodles today, 2 hours later, how high is my sugar going to spike? Okay, so the next time maybe you cut down to half a plate of noodles. Just like I said, you still can enjoy your food, but once again, you need to portion. You need to learn to portion it out. So the best thing is to have a food diary. Okay, all right. Then of course, make sure you know general hygiene is your oral hygiene. Check, make sure there's no dental caries or cavities. All right. Food, make sure that you check your foot. You in between your toes, check regularly, because diabetic patients, if you're poorly controlled, you lose that sensory pain sensation. So you're bound to bang or knock into something or step on a nail and you don't feel that pain. And then little do you realize it's turned into an ulcer. Okay, for those smokers and alcohol consumption, try to cut down. I know it's not easy to tell you to just stop completely and tell you, hey, tomorrow, you totally stop. Yes, I know that's being ridiculous, but cut down. Try to set a target and tell yourself, okay, within 6 months, I'm going to this one. So you must set goals which are reasonable within your capability. Okay, we can set goals for you, but it may not be adaptable to you. So you need to set something that's comfortable for you. All right.
Yeah. And doctor, also you mentioned just now earlier, walking in the shopping centers, right?
Yes.
How about the escalators? Just up and down, up and down. Is that
or you can take. They've got staircase. Or you can walk. You don't have to stand on the escalator and wait for it to move. You walk as it's going up. You walk on it.
Yeah, because why I say that is because most of the time when we say that you need to do exercises and kind of stuff, people always have a different concept.
Yes.
Some want to do like this. If you can look at here, so the doctor asked me to spend at least 1 hour per day on the treadmill, and he's sleeping.
Sorry, come again. Once I'm not able to see that. Hang
Can you
on.
see the picture?
No, hang on.
Okay.
All right.
So,
Oh yeah, I've seen this on Facebook and it's actually pretty cute. Yeah.
So so he's sleeping on the treadmill. I mean, of course, this is just for on the lighter side of the note, but I think exercise plays a very important part because
yes, I totally agree.
Without that, I think a lot of illnesses that are along the way. But of course, not only we are looking at weight loss, but we're also looking at diabetes. We are looking at blood pressure, atherosclerosis. I think these are all high numbers are coming up. There's a very ranges. Myocardial infarctions are happening at the age of 24.
Yes.
As early as 23, 25. So the norms are changed. Usually myocardial infarctions only happen at the age of 50, 60, 70, 80. But now the heart attacks
The
are,
younger age group, they are.
yeah, it's coming even lower and lower. So it could be a lot of reasons. I think most of the time, constantly on stress. I think it's not worth. I mean, of course, because of our condition as such at the moment, this pandemic and people are all stressed up. I think we need to learn how to take a step back because at the end of the day, it's not worth it to be
Yes.
stressed at all time. Because I know few people, even my own clients and friends, I think they are under constantly pressure because, of course, comes along with the different packages and different situations and different scenarios they're having. But I think we need to turn inward sometime to look within us first. Then the rest of the things are important because at the end of the day, when the illnesses comes in, like what Dr. Shalena said, it comes as a package, right, doctor?
Yes, I agree.
And it comes all together at the same time or within years. So we got to be very cautious about what we are, doing for our body. So are we going to cover anything more in this slide, doctor?
No, so my advice to all of you out there, to all the listeners out there, if you're diabetic, there's nothing to fear about. Okay, I mean, you need to accept that this is going to be with you. It's a lifelong disease. It's a chronic lifelong disease, but you need to take charge of the disease, not let the disease take charge of you. Right? So you need to control it, not let diabetes and its complications control you. Right? So you take charge of it. Now you take charge, you change your lifestyle, change your eating habits, incorporate exercise, because I feel it's teamwork. It's teamwork. All right. Just medication and diet doesn't do wonders on its own. So you need to incorporate exercise as well. So find time to do it. 25 minutes, 15 minutes every day is good enough. All right. Now you find it very difficult to this one. Walk up the stairs, walk up and down the stairs, your apartment or your office or something. All right. That there is still some form of exercise in it. All right.
Thank
Okay.
you.
So I think we are down to our last slide, Vance.
Yeah, that's right.
Okay,
14th of
so please, a humble request from all endocrinologists on behalf of all the endocrinologists all over the world. 14th of November is World Diabetes Day. So please support us. Please wear something blue. All right. And this is to show your support and help raise awareness of diabetes. Okay. Such a simple action can mean so much. And it's also a great excuse to wear jeans to work. All right. So to all those bosses out there, you see your fellas coming in, but unfortunately this time 14th of November falls on a Saturday, so all the more you can wear jeans.
But doctor, a lot of people are working from home, so they should wear jeans at home.
Yep, I agree, totally agree.
Thank you so much, Doctor. We have spent almost about 1 hour and 12 minutes to be precise, and we have shared so much of valuable information. And this is a recorded version, it's live, and any viewers, you can also share these videos. And those who are coming back do not have the fortunate time to to be live watching this, no problem, because it's recorded in Dr. Shalena's Facebook as well as Copy Events. Doctor, before we end, is there any wisdom words that you want to say? We know that this is a big issue for the human population.
All right, so
Is there
I,
some wisdom
I would always
words?
say the journey of 1,000 miles always begins with a single step once, right? You got to take that first step and make that change, right? Just sitting back and telling yourself, could I be a risk of diabetes? Am I diabetic? And not doing anything about it, it's not going to help, right? So take that first step. Go and get yourself screened. If you have the risk factors, we have listed out the risk factors for you. Or if you have symptoms and you're not sure whether you have diabetes, please go and see your doctor. All right. So
Thank you so much, doctor. I mean, we have also another viewer. Sorry, doctor. You were saying
Mhm.
something?
No, I said, stay safe, stay healthy, right?
Right.
And
We we sorry, doctor. Before we end this conversation, it's very interesting because I have one viewer who's been messaging quite constantly, but since he put it in Malay, I mean in Malay, his name is William. He's from Indonesia, so he has asked almost about 7 to 8 messages that's coming, but probably we will take it later. I'm sorry, William, because we are running a little out of time. Doctor has been talking without any drink, so she's probably very thirsty.
no, I'm good to go. Don't worry about
So
it.
I mean, we can take it in. Okay, maybe perhaps we just. I mean, it will not be do any justice for William if we don't answer any questions. So maybe he has asked in Malay. Maybe perhaps I think he can understand English. He might
Okay.
already in Malay.
The,
Yeah.
the, the question that he's posted is, apakah makan nasi putih biasa? Okay, for those who eat white rice on a daily basis, are they at risk of getting diabetes? Okay, so William, basically, we Asians, we are rice eaters, right? If you compare to the Westerners, our carbohydrate mainly comes from rice, right? So if you're going to eat, I told you that if you go by the division of the plate, where you divide it into four, and if it's a quarter of it, it's your rice, right? So, and or if make it easier, is the Chinese soup bowl, the small one, that rice, or probably half of it, then you're safe. Not to say that it totally contributes to diabetes, but again, it's portion. If you're going to eat every day, breakfast, lunch, and dinner, one plate of rice, yeah, then you're running into the risk of being diabetic. Okay, so whether it's white rice or it's brown rice or whatever it is, please portion out. Okay, small portions of carbohydrate and more of your protein and your veggie, which is your fiber. All right.
All right, doctor. Thank you so much once again. I mean, I'm sure after the pandemic is over, probably I will fly down to
Oh
our
yes,
neighboring
definitely,
country.
definitely.
Yeah,
Would love to catch up with you once.
yeah, and probably we will do more talks live with more audience. I mean, that's a
Can.
plan that we have. We are planned for. So it's good pleasure to know you. I mean, you have spent your valuable, most information that you've given to us, and it's priceless with your busy schedule and probably your rest. And apart from all
No,
this,
I
you
mean,
wanted to.
as long as it creates awareness to the public, once, because as you see, the numbers are going up. The numbers are going up, and it's very unhealthy. So I feel if there's a way to create awareness, if there's a chance for you to prevent yourself from becoming diabetic, there's a lot of things that you can do. Okay, so we've listed out everything. I mean, for um, those viewers who have tuned in, I hope this was something to help you out, but feel free to drop me a mail or anything if you wish to on my FB. All right,
Yep.
and yeah, I'll answer. I'll try and answer as fast as I can.
Do you want to give your FB? I
My
mean,
FB goes by Shalena, Shalena Nesratnam. Right,
okay.
so
I'm
yeah,
gonna
you
get
can
back to you on
hit
that.
me
All
up on
right.
messenger or anything. All right, I'll try my level best to guide you through.
Yeah. Sorry, doctor. I mean, we just came in another message. I mean, this particular
Sure.
person is asking. I mean, before we end this will be the last
Sure.
question. I mean, to be fair, eating salads at night, is it dangerous? And vegetables because they contains sugar. I mean, what is your take on that?
What? Okay. When we talk about salads, depends what you're putting into your salad. Are you doing a fruit? Some salads have got fruits in it, like a mango, avocado, or it depends, and it depends on your dressing as well. How much of mayonnaise are you going to add into it? Right? So other than that, I don't see any. This I don't think all salads have got sugar in it. I mean, basically everything has got a little tinge of sugar in it, but yeah, it just depends how much. Or as long as you don't pour a whole bottle of mayonnaise and you have, like, when you go to Kentucky and you have that coleslaw, yeah, that is way out lah. Okay, so if you're going to make your own salad, and you can cut down on your dressing, or you change your dressing and use something like lemon juice rather than a mayonnaise or Thousand Island dressing, or you cut back on your dressing, maybe you reduce the portion. I think you're good to go.
Thank you, doctor. I think there are more questions coming up, but then I think that's it because we will answer them all offline. It's a great pleasure to have you at Copy Raiders. It's my blessing as well to
Thank you
have
very much once. Thanks.
great discussion. You're so humble, down to earth, and you patiently answered some questions that our viewers posted and shared all your valuable information, your years of experience. You just given to us, and it's a blessing. Thank you so much once again. We will stay be connected, and probably we will have more debates over a bottle of wine, whether we should be taking half a bottle or two
Yeah,
bottles.
yes,
But
I'm keeping tab on that once. Don't worry, I've got my little black diary and food diary, which
okay.
I'm keeping tab, right? Yeah.
Yeah, but you see, doctor, what my calculation is right, right? 2 glasses of wine a day will makes you about one bottle a week, probably more
Yeah.
than a bottle. But so having
True.
4 bottles a month. So the
Yeah.
calculation just goes away. So probably the one we will need to argue on that. You
Okay.
know, probably over a glass of wine, we should discuss about
Definite,
that.
definite.
Thank you so much, and
Thank you, Vince. Thank you
we
so
will
much
stay in
for
contact.
having me. I'm very honored, and I'm very glad you've given me a chance to share this information with the public. So please, once again, support us on November 14th. I know it's Deepavali Day as well. It's falling on Deepavali Day this year. Please try and go blue. All right.
Thank you, doctor. That's it.
Thanks,
14th of November. Mark your calendars. It's World Diabetes Day, and wear something blue. All right, just to show your support. And I think together we can reduce and prevent diabetes. Thank you so much, doctor. And we
Thanks,
will
Juan.
catch up very
Okay.
soon.
Good night.
Yeah, good night. All right, viewers, thank you so much for joining us. And I know it's pretty late. We spent almost now it's almost 10:20. Thank you for the viewers who are still watching. It's my great pleasure again in Copy with Vance. It's always about different topics. Not only we are focusing on fitness, we are talking about health, We're talking about lifestyle changes. So there's a lot of interesting topic that's coming up, lined up in the next couple of weeks. That's every week there will be a different content that I'll be bringing it up to the viewers as suggested. Is there a particular topic that you want me to bring it up and share it in the social media? Please feel free. It is been able to share it to YouTube and to my pages as well, Kopi Events and Vanan Guinasami, and so my Facebook. So you can actually come and check all these videos out there, check all the informations. And if you do have any questions, please feel free to send us a message or send me a message, and very happy to answer them. If I know, if I do not know, I'll research it and give it to you. Wish everybody a pleasant evening, and this is Kopi with Fans signing off. Ciao.